Hello, this video is intended to provide a summary of the Arizona Language Acquisition Task Force 2022 final report. A new law in Arizona, SB 1092, addresses language acquisition and literacy development for deaf, hard of hearing, and deaf-blind infants and children. The Arizona Commission for the Deaf and the Hard of Hearing was selected to create a task force and 3 subcommittees. The individuals chosen to serve on the task force and subcommittees represent diverse educational and professional backgrounds and have differing areas of expertise. Data indicates there are currently over 2,400 deaf, hard of hearing, and deaf-blind children in the state of Arizona. These students are educated at the Arizona State Schools for the Deaf and Blind, or ASDB, at their local school district, Sequoia Deaf School, and other schools. The 3 subcommittees met regularly and worked tirelessly to complete their tasks. The first subcommittee is the Data and Demographics Subcommittee. This group was tasked with looking at the available data and statistics. The second subcommittee is the Systematic Connections Subcommittee, which looks at how governments, organizations, and agencies work in collaboration with one another. The third subcommittee is the Assessments Review Subcommittee. First, we will look at the work of the Data and Demographics Subcommittee. This group was tasked with locating and compiling all currently available data. The reliability and validity of the data available is largely unknown. The subcommittee compiled information from 5 entities that collect data and maintain various databases. It was noted that some of these entities maintain robust databases, while others collected very little data. On the graph shown, blue represents public schools and red represents schools for the deaf. Based on the information collected, these are the recommendations from the subcommittee. 1. Examine the reliability and validity of data available on the language acquisition and academic outcomes of children. 2. Collect longitudinal data with the purpose of identifying trends in screening, diagnostic, intervention, and data outcome. Consider using a common identifier to link data across systems. 4. Determine who should have oversight of the collection and analysis of data. 5. Conduct in-depth analysis of data, summarize findings, create an action plan, and monitor ongoing progress. 6. Research how other states gather, analyze, and respond to findings accordingly. 7. Create and develop standardized definitions for cross-usage amongst agencies. 8. Secure additional funding to support establishment of staff to collect, analyze, and disseminate data. 9. Collaborate with the Arizona Department of Education to analyze data for key findings and implications regarding the deaf, hard of hearing, and deaf-blind population in the state. Those are the 9 recommendations. Now we will look at the work of the Systematic Connections Subcommittee. The subcommittee agreed with the recommended practices. The recommended practices require that a child's hearing be screened by 1 month of age. By 3 months of age, follow-up testing should be done to identify the child as deaf, hard of hearing, or deaf-blind. By 6 months of age, the child should be referred to early intervention. A trained professional will work with the family and with the child starting at 6 months of age. The subcommittee recognized that the 1 month, 3 month, and 6 month protocol presents potential challenges to families. These challenges were discussed and families had the opportunity to share their experiences. Here are some of the comments we received from families. Resources for parents of deaf and hard of hearing children are limited. Individuals working in the field are not familiar with the needs of those who are deaf, hard of hearing, and deaf-blind. Parents are unaware of their options when their child receives a diagnosis. Families need more access to information in their native languages or to information that is culturally and linguistically appropriate. Placement options are not the same for all families depending on where they live. Parents are unaware of their rights as decision makers for their child's preschool placement. The subcommittee hosted a panel with diverse representation. Represented on the panel was a deaf Indigenous person, a hard of hearing person living in a rural area, and a Black deaf person. Members of the subcommittee were given the opportunity to ask questions. Through the work of the Systematic Connections Subcommittee, 3 recommendations were identified. 1, require medical professionals and audiologists to give unbiased and evidence-based information to families on all language approaches and technology options. 2, increase resources to help families follow up on a failed screening to complete the 1 month, 3 month, and 6 month protocol. And 3, increase provision training for screening personnel to counsel family regarding the importance of follow-up and sharing appropriate information on possible outcomes. Last, we will look at the work of the Assessments Review Subcommittee. It was identified that the Arizona statewide assessment team needs to be reestablished and retrained. ASDB uses language assessments that are intended to assess the language of deaf, hard of hearing, and deaf-blind children. Other schools use language assessments that may not be appropriate for deaf, hard of hearing, and deaf-blind students. ASDB can provide these assessments to the school districts they partner with. However, not all school districts have a partnership with ASDB. There are currently 6 assessments used in the state of Arizona. Each of the assessments presents different challenges and limitations. The Assessments Review Subcommittee has 7 recommendations. 1, establish a statewide assessment team for all deaf, hard of hearing, and deaf-blind youth in Arizona, regardless of their educational placement. 2, provide annual or biannual assessments in the modalities and languages that best fit the child. 3, utilize assessments for guidance on the language development discussions by IFSP and IEP teams when assessing the child's progress in language development. 4, develop more partnerships between ASDB and school districts to ensure every single deaf, hard of hearing, and deaf-blind child is assessed. 5, to ensure ASDB is able to assess every child, investments are needed in the Child Find system to ensure every deaf, hard of hearing, and deaf-blind child is identified. 6, provide certified staff with additional training in order to become trainers. This will help to address the shortage of assessors and grow the pool of certified staff. 7, create positions for assessors to travel to school districts to conduct assessments on site after a needs assessment study. The subcommittee agrees that ASDB should be designated as the agency to coordinate and implement assessments statewide, share data, and communicate information regarding language acquisition. This will support the work of ASDB, the Arizona Department of Education, and the Arizona Department of Health Services. ACDHH will ensure that data is shared with the Arizona Department of Education and the Arizona Department of Health Services through data sharing agreements. This information will be collected and analyzed for further publication. For 6 months, the Language Acquisition Task Force and subcommittees worked to navigate the collection of information in order to determine recommendations. These recommendations will be used to determine next steps. If you have further questions, please contact ACDHH.